Hello, everyone out there. Welcome to part 2 of Enhancing Motivation in the Treatment of Adolescents with Selective Mutism. I'm your moderator for today. My name is Dr. Allison Miller. I'm a licensed psychologist with a group private practice specializing in childhood anxiety disorders, including selective mutism, and I'm a proud former member of the SMA board. I'm very happy to be here again today for the follow-up to what was a very informative part 1 of this webinar that we had a couple of months ago. Today, this webinar is brought to you by the Selective Mutism Association, and it was made possible thanks to a generous grant from the Gordon and Marilyn Macklin Foundation. This webinar is being recorded, and it will be available on the Selective Mutism Association's YouTube channel within 24 to 48 hours. A link to the recording will be sent to every registrant early next week. You will notice on your screen there is a box to submit questions. I will receive those questions once you type them in, and if they're quick ones that I can answer myself, I will certainly do that back to you. If they're questions for our presenter, who I'll introduce in a moment, I will relay those to her during the question and answer portions that she's allowed throughout her presentation today. So feel free to send whatever questions you have. So without further ado, I'll introduce Dr. Shelley Avny. Thank you so much for being here again and sharing your wonderful insights into working with teens. Dr. Avny is a clinical psychologist and founder of the Child and Adolescent Anxiety Practice in Manhattan, New York, which is a private practice specializing in the assessment and treatment of anxiety disorders in children and adolescents. Dr. Avny subspecializes in providing services to youth with selective mutism. In 2016, she developed WeSpeak, the first behavioral group intensive for preteens and teens with SM, which was featured in a BBC World News documentary and has been presented at numerous conferences. Dr. Avny also provides training and consultation services to mental health professionals and school staff on various topics related to selective mutism. As an adjunct clinical supervisor at Yeshiva University, she also trains graduate students in implementing effective cognitive behavioral therapy. Dr. Avny is committed to improving the lives of youth suffering with SM on an individual and global scale through research, treatment, and dissemination. Dr. Avny, I'm going to turn this over to you. Thank you so much.
Thank you, and thank you guys for having me back. And actually, before I move forward, I want to also reiterate that thank you to the Gordon and Marilyn Macklin Foundation for their grant that makes these webinars possible. So I know that we had so many questions, so many thoughtful questions, and there was so much interest in the first talk that I gave, and I think that just speaks to how important of a topic this is and how complex and nuanced this topic area is. And so I love that we get so many questions, and I love that there's such an interest in it, and I'm excited to continue to share my knowledge with you guys. We're going to start with a quick review from last time, and then I know there were a lot of questions about the virtual era, so we're going to break that down a little bit. We're going to talk about rewards and contingencies. We'll talk about what to do with medication resistance, and we'll talk a little bit about parenting, although that weaves into all of these other domains that we're going to talk about. I wanted to make sure that I am able to answer everyone's questions from last time, answer any questions that you may have this time, and include new content. So I have kind of broken down the webinar into various themes, which you see here, and then there's going to be an opportunity following each segment for question and answer, which actually sounds like I'm doing a presidential debate with the segments in the Q&A, but that's going to be how it's structured. So Allison will take your questions, and then at the end of each segment, I'll be able to answer them. All right, so we're going to do a little pop quiz here. So some of you may have attended the first one, some of you may not have, but I am going to be expanding on some of the concepts that I shared in that first one, and so I want to make sure that everyone is refreshed from from the material from the first one, and that there's some framework and foundation that new viewers might have. So whoever did attend the first webinar in this series, I'd love if you could write in the question box what some of your main takeaways were from that one. And Allison will read them as they come in.
All right, so I'm excitedly watching my question box. So we need people to send in what they recall as just some of the main points that stood out from the part one of this great presentation. I'm still waiting, so people are being shy.
Well, we are very good at distress tolerance and waiting as long as needed.
We'll count to 5 in our heads. Great. No. Well, I can share a takeaway that I remember. I remember a lot, but one of the things that really stood out to me was how important the rapport building piece of treatment is, and that without that you're not going to get anywhere, and what wonderful suggestions you gave us for really focusing on rapport building. And there are some coming in now, so thank you very much. So one is, someone said, a big takeaway for me was how to do the briefing intros online. Okay. One, prepare client for talking at the next session, so that first session, there's no expectation of speech, and how you set them up to be able to respond, I think, to one question that was predetermined at the next session. The use of motivational interviewing skills is important. If the teen can choose from 2 questions, so same thing, have the teen choose from 2 questions that he or she can probably answer the next time. The first session is for explaining treatment to the teen with no questions requiring verbalization. So that's what we have so far.
Yeah, that was actually a great overview. Thank you guys for sharing those takeaways. So I think you covered a lot of these. So we use the prep sessions to help reduce some of the uncertainty around what therapy is going to look like, and just start off in a low pressure situation. We're using them to just take these small steps to get them verbal, and obviously to build their motivation through that process. And one of the big takeaways that I heard some of you guys mention, give them choices in the question that they're answering, but really along the way, with every new task that we're working on, we want to give them choices and make them feel like they have agency in the process. And that's, again, because we're working with teens, and part of being a teen means that they want to feel independent and exert that independence and have some control. And so by giving them choices and really emphasizing that collaboration in the process, and focusing on the impairments that they feel and the goals that they have, that's really going to help them feel more in control and help them feel a little bit more empowered. And then we also talked about helping parents minimize enabling if the teen is a little bit too comfortable in the situation, so much so that they don't really want it to change, nor are they motivated for it to change. All right, so last time I know we got a lot of questions around what to do in this weird virtual era that we're in right now. And so first I'm going to talk a little bit about what to do in the actual therapy sessions that we might be having with our teens virtually. And so we'll go through a number of different types of exposures here, or different variations of exposures that we would normally do. But I wanted to start off with a question that we received in the last webinar about how to deal with mouthing, and how to kind of shift away from that and get them more audible. So in thinking about this, I'm going to share some strategies, but I also want to preface it by saying that I try to avoid starting with mouthing as much as possible. And so I think there's probably only been 3 kids that I've needed to start with mouthing. And that was only after realizing that, any other strategy was not going to work. But the ideal scenario would be really to start with an easy question, an easy answer, something, where you can kind of shape the variables, but while they're audibly answering from the beginning, because as I'm sure whoever asked this question maybe has experienced, if they start off mouthing, it's going to be much harder to get them out of that, and so you're going to have to actually do more work down the road versus just kind of diving into some sort of audible response or variation of that in the beginning. So if you end up in a situation where you are needing to move out of the mouthing territory, there's a couple different suggestions here. So one is just turning away from them so that you can't read their lips. And this is one that I found very useful for me to use and for actually parents to use even during the fade-in if the teen is just verbalizing to the parent in front of the clinician. And the reason that we do that is that sometimes we can interpret what we're seeing in reading lips as being able to hear it. And this might not be the case. So parents will say, like, I think I heard it, but like, I'm not totally sure. And a lot of the time this is because they're actually just reading the lips. And that makes you feel like you're hearing it. So a way to eliminate that is to actually turn away so you can't read their lips, and anything that you're hearing, you're certain then that you're actually hearing and not attributing just to seeing their lips move and knowing what word they're trying to express. We also can use the computer to kind of play around with some variables around audibility and mouthing. So I've actually had some kids who in person, if they've had a hard time being audible or speaking for the first time, they actually have had an easier time doing it in my ear, which maybe seems counterintuitive because they're closer and they are, it's much more intimate there, but they also have to not talk as loud in those situations. And so similar to that and kind of mirroring that, the virtual version of that would be saying it right into the speaker, so they can get really close to the speaker. And I've actually found that that's been really, really helpful in getting teens audible on this virtual platform. And it also takes away some of the, face-to-face interaction, which can be eliminated in other ways that I'll mention in a second, but it's much less effort for them to need to exert if they're saying it right into the speaker. You can also play around with, whether your screen is on, whether their screen is on, if you're turned away, if they're turned away, the distance from the screen. So a lot of times, they're okay saying it, but just don't want you looking at them, or, they want to be turned around themselves. I had a kid who actually had not verbalized to anyone in multiple years, including family, and she was an incredibly honest kid. And so the way I actually got her to verbalize was in just doing it to herself, but with myself and actually her sister in the room. And neither of us were hearing it, but we just wanted her to say something aloud because she hadn't said anything aloud in years. And so we kind of used an honor system where we didn't need to hear it, but she needed to hear herself saying it. And so we started that way and then kind of moved closer as she continued to say it in a way that was audible to her. And so she would actually let us know each time if she was able to hear herself say it. The other thing that you guys can do is use use the device and kind of position it accordingly, where you could actually, if you're doing a fade in, you can put it next to, or the parent can put the device right next to them. And you can even say that the parent needs to hear their response. And so, I mean, presumably by default, if the parent is hearing and the screen is right next to the parent, then you'll hear as well, and then you can create more distance between the kid and the parent, but with the device right next to the parent. So it's almost as if the kid is talking to you. And then the other thing is to use very standard answers, and ones that maybe they can rely on repeatedly. So I have asked kids before, so we're only going to ask one type of question, because I know we can get used to asking a lot of different forced choice questions. But if they're having a hard time even getting audible at all, then you want to really narrow it down to, we could either use yes, no questions, we could use forced choice questions, but it requires a 1 or 2. So then they would just say 1 or 2. Or we could do A or B, similar to the 1-2 forced choice questions, but they say A or B, and then that's what you rely on until they become audible. And so it's just repetitive. Then they know exactly what type of answer they're providing, and they're able to kind of get practice in doing that. And it's very interesting. Kids really do have a preference between yes, no, A, B, and 1-2, and it's varied by kid. So that is around mouthing. In terms of other exposures, I have used this time actually to work a lot on perfectionism and I don't knows, because a lot of the time that is, as kids get older and still have some of these selective mutism or social anxiety symptoms, it's often driven by perfectionism and wanting to give the perfect answer, wanting to, make sure with 100% certainty that their answer is right, wanting to word it perfectly. And so I have mentioned before that they're really able to kind of give minimal responses a lot of the time, but these are usually factual responses that require 1 word, but if there's any uncertainty around it, then that's when you might see a frozen response. And so I've been using this time to really get kids practice in guessing answers that they might not know the answer to, that might be wrong. I've been doing a lot of estimates. So I'll say, like how old were you when, or, when did you get your kittens? And they don't know the exact date. So I'll say, just estimate, just guess. And I'll let them know, some of the time you may be right, some of the time you may be wrong. But the perfectionism exposures are really, for the older kids, are really closely tied to the SM symptoms, actually, because so much of the SM at this point is driven by wanting to be right and wanting to say it correctly and perfectly. You can also use this time to practice presentations. And so I have been bringing, other people in, and, Zoom makes that very easy. And so that's another thing that can be practiced in therapy sessions during this time. But I would say that probably the bulk of my sessions, particularly with kids who are struggling most with peers, are spent working on social skills. And so I know that another person had asked a question or had emailed in advance asking about how to build up the social skills of teens with selective mutism. And that's a great question, actually, because there's a lot of deficits in social skills with these kids, and it's not because they were born with these deficits, and it's not because they're necessarily on the autism spectrum or don't have the capability to have these skills, but it's because they've gone years and years and years without practicing social skills if they haven't had much interaction with peers. And so it really does require, in order to build up their confidence and their skill set and set them up for success, when we are having them do exposures with peers, it requires them really building that skill set. And so I'll spend a lot of time in my virtual sessions now just practicing like regular back and forth conversation, starting with just having them give a full sentence instead of a one-word response. So if I say, oh, what kind of dog are you getting? Instead of saying mini golden doodle, they will have to then say, I'm getting a mini golden doodle. And so I'll shape that, then we'll work from there on asking follow-up questions, starting with a follow-up question that just kind of repeats back to me the question that I asked them. So if I said, what did you do this weekend? And they said, I played video games, then they would ask me, what did you do this weekend? And so we practice with that, and then we'll practice expanding the follow-up questions in a way that actually follows the conversation. And so then, if I say, I went to the beach, then I'll kind of prompt them to ask me back a question about that, which might be, what beach did you go to? What do you do at the beach? So then the next thing we work on is elaborations, and this is answering the question and giving additional detail. And so this is something else that, needs to be pretty heavily shaped, but I do that. I'll say, so you just told me blank, what's something else that you could add about that? So I'll say, so you said you played video games this weekend. What's one detail that you can add to that? And then they'll say, I played video games. I am playing a lot of Fortnite now. And so we'll practice that, and a lot of that initially obviously has to be prompted and scaffolded, and then we'll actually practice sharing information or telling a story, which is definitely the hardest thing for them to do. And so some of my go-tos are like annoying sibling stories, or annoying parent stories. So, oh yeah, my parent was so annoying, this morning, or like my brother was so annoying, he did X, Y, and Z. And so, I'll again, very heavily scaffold that, so that I'm kind of helping shape a story, and then I'll actually have them share that story with me, so that they're learning to actually just share stories in the context of just regular conversation. So that is that's how I'm using most of my sessions now. I'm also doing a lot of planning and problem solving, in just thinking about, which we'll talk about peers in the next slide, but thinking about, what they can do in between sessions, in order to kind of keep all of their work going, and continue their practice exposures. Okay. So with peers, I'll talk a little bit about what I'm doing in session to continue to actually promote those social skills and social exposures with peers. So I've been doing, which I was doing a little bit of before COVID, but I'm relying more heavily on that now. I'm doing dyads, where I'll have two kids around the same age and do sessions with them together. And we're either, if it's a kid who's a little bit more advanced and able to kind of respond to anyone, and has worked a little bit on social skills, then we'll actually just spend those sessions doing strict conversation practice. And I'll do a lot of prompting during that time. So I'll say, all right, so now go ahead and ask a question back. And, that kid might ask a question, and then I'll say, and this is all to scaffold it, and over time, obviously I remove some of this, but then I'll say, okay, she just shared blank with you. What's something that you can ask her back about that? And so then, that kid will ask the question back. And so then I'll kind of shorten it more and more to, once they get the hang of it, to question, elaborate. And so they're just getting these very minimal prompts, and they're able to then have a back and forth conversation. I also have been turning my video off, my screen off, so that it almost mimics the kids just having a conversation just between the two of them. And so I'm trying to remove myself from the conversation as much as possible. So it's really just the two of them looking at each other and talking to each other. And if I need to during that time, I'll still prompt either through the chat box or just using my audio. And for the kids who are a little bit less advanced and are just getting practice in verbalizing at all to other kids, then we'll do some sort of joint activity or game that involves verbalizing. I also have focused a lot on like obviously maintaining contact with other kids through texts, calls, FaceTimes. In every single session, if it's a kid who is not regularly texting with multiple friends, they know usually to come to our session with phone in hand, because right away they'll be shooting off a text to any of their contacts. And then some of the goals that we'll set will be, to do that several more times throughout the week, or to maintain the conversation that they started in our sessions. So we're making sure that contact is maintained in that way. And then in terms of calls and FaceTime, so a lot of these kids might have a couple kids that they're texting with, but FaceTime is at like a whole nother level, or phone calls at a whole nother level for them. And so I've had a couple kids where I've assigned that, but it's been too hard for them to do on their own. And so I've actually used the session time to have them FaceTime a friend, or someone that they are establishing a relationship with, and this one ensures that they are doing it, and there's accountability around that. But two, it also allows me to be able to kind of observe in live time kind of what they look like in conversation with with a friend or an acquaintance, and be able to actually give feedback and prompt if they get stuck. So it's definitely anxiety provoking for them to do it in front of me, but they've all found it really helpful. As much as possible, we want to encourage socially distant hangouts during this time. And so, that could mean bike riding, that could mean outdoor dining, that could mean ice cream, getting ice cream together. But that also involves, understanding from the parents what they're comfortable with, understanding from the parents of our kids' friends what they're comfortable with. And so this involves a little bit of information seeking. But I'm still obviously heavily encouraging that and facilitating that. And in terms of social goals during COVID, like I was saying before, my primary goal is to just maintain where they were at before, and not lose any of those contacts, not lose any of the work that they had done, to continue to practice in whatever capacity they can. But I think that, and I'm going to talk about this a little bit more in the next slide also, I think that there's a lot of pressure felt by parents and even us during this time to, keep everything going and really maintain the momentum. And it's really a tricky time. And I think, it's good to have some level of acceptance that we won't be able to do everything that we were doing before, or maybe they won't be able to advance at, as fast a pace as they had before. And that's okay. I think as long as they are maintaining where they were at, then I think, part of it is just an acceptance about where we're at and what the confines of that are. Okay, in terms of school, I don't know if you guys have found this as well, but I have found that fade-ins are actually much easier virtually with a teacher. So I actually love Zoom for that purpose. And It has made scheduling easier. We don't have to go to the school. There's usually a lot of red tape around getting into a school, and now we could do all of that virtually. And so, just as an example, I recently did a fade-in with a teacher, and the kid really likes Roblox. So she pulls up Roblox, she does a screen share. I start off just, chatting, giving the teacher some information about Roblox. I ask a few questions about Roblox. She answers beautifully. The teacher asks some questions about Roblox. She answers beautifully. This is a kid who has never in her life spoken to a teacher. She's 10, and she's never uttered a word to a teacher. And this, it almost felt too good to be true, but I think this can actually be a very helpful platform for that. And so in the next one, I started off with her and the teacher. I then said, I gotta go take care of something over here. You guys keep going, and they're off and running. So fade-ins, great. Use this time to do that. And in terms of exposures in school and what we can kind of expect for kids to be doing. So I wanna just give a little caveat here that's similar to the last one. So I think there's also pressure. Oh my God, we have to make sure that we're continuing exposures in school and that they're participating in every class. And in some instances, that's just not possible. And in other instances, that's actually not the norm. And so I am very clear with parents to make sure that we are doing what's consistent with what other kids in the school are doing. Because if most kids don't have their video screens on, then we don't want, our kid to be the one kid who has their video screen on just for the sake of an exposure. Yes, it would be a good exposure, but it's not as relevant to what's happening right now, and kind of what the norms are, and kind of getting them closer to those norms. So same thing with participation. I with each of my teens that I'm working with, I get a really, really thorough idea of how their virtual school is working, because everyone's virtual school is completely different. And so I do like a pretty comprehensive assessment about how everything is structured, including what is the expectation around video screens? Do most of the kids have their video screens on? What's the structure for participation? Are most kids called on? Do kids volunteer? When they do volunteer, how does that work? Do they push the button? Do they raise their hand? Do they just chime in? If kids need help, how are they asking for help in the virtual classes? Are they mostly using the chat box? Are they mostly asking the question in class? Are they emailing the teacher to maybe set up a meeting with the teacher separate from class? Is there any opportunity for partner work, or is the teacher using breakout rooms where you guys are working with other kids? So I'll really ask in depth all of those questions, so I could see kind of what our anchors are and where we want to get our kids to. Because again, if yes, it would be a great exposure if they said, excuse me, Mr. Smith, I have a question. But if all the other kids are asking the question through the chat box, we don't want to force our kid to do something that's totally different, both because that wouldn't even be entirely appropriate, but also because we're trying to get buy-in from the kid. And if we're saying we want you to do this thing that's totally not relevant to what's actually happening in the classroom, it's going to be really hard to get that buy-in, and then that's going to really impact the motivation and the subsequent work. So in terms of participation, all of this stuff is really stuff that can be done in person, with the teacher being able to kind of prep the teen in advance about what question is going to be asked. The teen could even answer in the chat box, and then the teacher can start off by just saying, oh, here's so-and-so's answer. The teen might be able to type it in the chat box, and then once there's verification that that answer is correct, which sometimes they need as the starting point, then the teacher can call on them. So there's a number of different ways to kind of facilitate the participation. in the virtual platform. Asking for help is something that I definitely want to mention here, because these are kids who are not going to, for the most part, initiate asking for help, even in the classroom. But in the classroom, the teacher has a better sense of how well the teen is following. And so they're able to see, okay, are they on the right page? Are they doing the work right now? Are they staring at a blank page? Does it look like they're getting stuck? And that's something that's much harder to gauge over a Zoom. And so these kids are at a much higher risk of actually falling behind, because in the classroom, if the teacher sees that they're stuck, then they're going to come over, they're going to offer their help, they're going to maybe initiate a meeting with them, but they're not going to be able to see that virtually. And so we want to be aware of that. And for those kids who are just not at the point now where they're able to initiate that, we want to incorporate some sort of system where they are able to kind of check in with the teacher on a regular basis, and not rely on them initiating asking for help. So I actually have a system set up with a school where at the end of each virtual class, my teen and the teacher will stay on, and the teacher will say, did you complete the worksheet, or do you have questions about it? Did you complete the worksheet, or do you need help? Did you complete the worksheet, or you left a couple blank? And so this is a way to just kind of build in a regular check-in to make sure that she's keeping up. But it also is a way of shaping, in a way, her asking for help, even with prompting, because then she'll have to say, I have a question, I didn't get it. The teacher might say, do you need help, or you don't need help? And then she might be able to say at that point, I need help, because it's not her initiating. And so there's a way to kind of build that in to actually shape that behavior. And in terms of presentations, it's the same thing as what we would do in person, where it might start off with a recording, or with a teacher one-on-one, or with a couple kids in a breakout room. All right, so let's see if we got any questions on the virtual era.
So if anyone does have questions, send them in. I can't believe this, there are no questions, and that must be because you're doing such an amazing job explaining everything that there aren't even questions left. I do have one personally, and we'll see if any come in while I'm asking mine. So I love that. It's really interesting, the idea of you observing the teen on a FaceTime call or a phone call. And I was wondering if the other participant in that conversation is told that you will be observing, and if so, is the teen, how hard is it to get buy-in from the teen to have their like for the other person on the call to know that their therapist is listening in or watching?
Yeah, no, it's a great question. So I definitely don't observe. And so if they're doing FaceTime, then I'm not seeing the other kid at all. So I'm just listening. That I don't have the other kid know, but our conversations are our conversations. I feel like I'm a part of their conversations. They're kept pretty short. One, because we also are doing therapy, and I want them to be successful. And so if we have them, plan for a 15-minute conversation, then, it's going to be really hard for them to maintain 15 minutes of conversation. And so so we'll actually talk about it in advance that, we want to get through basically one conversation. We have an exit strategy of saying they have to go and why they have to go, and when they'll talk to them at another point, but we usually keep it to definitely less than 2 minutes. So it's really just kind of one conversation practice. The other kid does not know, and they're certainly not getting into anything private at all, because at the point that we're doing this, these kids are hardly having conversations at all. And so I definitely wouldn't do it for kids who are more conversational, and it could go in that direction. But these kids are, at the very, very basic early stages of having like one quick back and forth exchange about their weekend.
Okay, yeah, that makes total sense. Thank you. So how to help a student struggling with responding in the chat room, or chat box.
If I can ask a follow-up question, would that be to the teacher or to the clinician?
So can the question asker, a teacher, thank you, the teacher.
A teacher. Okay, so I think that that's probably a matter of potentially initiating, because I'm wondering if the teacher asked the student a question directly, if the student would respond in the chat box. But if it's the teacher posing the entire question, or the question to the entire class, then I think it might be harder for the teen to take the initiative and answer, knowing that other kids could be answering as well, and there's less pressure on them to answer. If it is a question that maybe the teacher asks the teen to respond in the chat box during class, and the teen still isn't responding, even when it's kind of prompted by the teacher, then I would almost remove that aspect of it, and even practice just chatting to the teacher in the chat box one-on-one, just to get them comfortable with the idea of doing that with the teacher. And then I would say that having the question prepared in advance, so that the teen knows exactly what question they are going to be asked and are ready for it. They could even write it in the chat box in advance and have it ready for when they're prompted, so that they can just hit like send at that point.
I love that last little tidbit there. That is like gold to me. I'm already thinking of like who I'm gonna do that with. Love that. So someone says, you are fabulous, and he wonders if you are using social thinking curriculum.
Some of the stuff definitely was pulled from that curriculum. Some of it was pulled from the peers program for teens on the autism spectrum. Some of it was pulled from the social thinking curriculum. So yeah, in terms of the social skills training, I've kind of pulled from a number of different sources.
Great. What advice do you have for goal setting for making video presentations for a verbal child who previously had SM, currently struggling with anxiety but willing to work, 12 years old? That may be very specific. I wonder if that's something that maybe to answer via email later. And I actually can't remember if I mentioned that in my intro, that any questions we don't get to, Dr. Avny can respond to later. And the last one here, I'm sorry, two. What do you do when you're prompting for more of a sentence than just a word, but each time you're still getting just single words?
So you could even start the sentence for them. So you might have to break it down as small as that, where if they say mini golden doodle, then you can say, I'm getting a, and then they can say mini golden doodle. Okay, great. I'm getting a mini, and then they'll have to finish the sentence, and you kind of back it up until they're actually saying the full sentence, and then you start over. Okay, so in a full sentence, what kind of dog are you getting?
Great, and I'm the one getting it down. Everybody today, so that's we were chatting about that before. Okay, great. I'm going to let you move on to the next section.
Okay, great. I just looked at the time. We have 15 minutes. I can't believe it. So, all right. So contingencies. So contingencies, I want to preface this by saying that this is when you're making access to something, perhaps something that they're already getting, contingent on them putting forth effort or taking steps. And so the assumption when you're using contingencies is that there's a lack of effort. And so this is something that that I definitely will use when there's like zero motivation. And in doing this, it's really important to differentiate effort from, like, I'm not putting forth effort and I have no motivation and I'm not doing a thing, versus my anxiety is too high right now and I'm totally overwhelmed and this is just too hard for me. Because we don't want to punish them and we don't want them to feel punished for not being able to do something because of their anxiety. And they're going to see contingencies as a punishment. And so we want to make it very, very clear to them and be very clear with the parent also that we only use contingencies when there's a total lack of effort. And you can tell usually that there's a total lack of effort in any one of these ways. So if it's something that they've already done before and all variables are the same, then, you know, it seems like this is something that they could be doing now. I'll also say to a lot of them, okay, well, if you can't do it, then we always have two options. Either you do it or you explain why you can't do it, why it's too hard. And I even allow them to write that down because I know that might be too hard to articulate. But it's always one of those two. So it's okay if you can't do it, but I just need to understand why it's too hard for you, why you feel it's too hard for you right now. And if we can't establish that, then we got to do it. If you've been inching back and you've inched back so much that you're back to the previous step and there's really no intermediate step or no smaller step, then at that point it's okay to really assume come on, this is a matter of effort now, this is an anxiety. If they've been given a lot of very reasonable choices and they've rejected all of them, just like, nope, I'm not doing any of those, then that's usually a cue that it's a lack of motivation or effort. And if there's a known reason other than anxiety for them to not do it. So I was working on a kid who is totally verbal with me. She has SM, but she's verbal with me. And we were working on like homework related stuff and avoidance around homework. And so I was trying to direct her to an exposure around doing her homework, and she didn't want to do that. And so then she had stopped talking to me. And I knew that she is fully able to talk to me. And so then we set a contingency plan where, okay, so I need to see this, and this from you in order for you to get your Dunkin' Donuts after this or something. And instantly she was verbalizing again to me. So transparency is very important here. In-session contingencies can be like, if the session is aversive to them, it can be, you know what, once you meet X, Y, and Z goals, the session can be done. We can finish early. You could do a fun activity for the rest of the session. It can be that, you know, you have to do this in order to get access to your phone. Some of our old perfectionists who love to start their homework early and spend a lot of time on their homework are actually really motivated to get to their homework. And so for these kids, I might actually even schedule some extra time. And then it's a matter of, okay, when you meet X, Y, and Z goals, then we're good, and you could go start your homework or get on your phone or play your video game. But we're here until you do that. And again, you can only do that if you know that they're capable of doing that. Out of session contingencies. I'm going to talk about grades in a second. Existing privileges, so it could be, you know, okay, you could only get dessert tonight if, or, you know, you can have your phone if you meet this goal each day, and social activities. I have a patient who has a boyfriend who is a few hours away, and they obviously want to see each other as frequently as possible. And so we have set up a system where, because it's still much harder for her to engage with peers and to initiate hangouts with peers, and kind of follow through on those relationships, our system is such that she has to have 3 hangouts in between every time that she sees her boyfriend. And so if she wants to see her boyfriend, she's got to get those 3 hangouts in between each one of those. In terms of grades, I have a kid who has really struggled with giving presentations. That's kind of her stuck point. And it's become very all or nothing with her, where she's kind of gotten to a certain point. She's definitely convinced herself that she can't do it, and she's able to do it to the teacher, but has not been able to move past that. And I've actually been working with this school for a couple of years now, and she has not been able to move forward despite the IEP goals that we have every year, despite the very elaborate plans that we have in place. So it got to the point this year where, it's each year when we've had these plans, she's kind of gotten out of it or she's refused to move forward, and we've offered her every small step possible, and she's not moving past that or, taking any of the choices that are available to her, which again are all very much scaled back. And so at this point, we have said that we're still accommodating in giving you these options, but it's no longer an option to just do it to the teacher, because you have been doing that for so long, and because it doesn't seem like you're putting forth the effort to move forward. And so it's going to, if you can take one of these options and you'll be graded like any other kid, but if we maintain where we have been, then your grade is going to be reflected in that. And again, that's only because there's just a heavy resistance to moving forward, even in a small step. In terms of rewards, so I'm gonna just show you guys this. So when we're working with teens, we can't just use stickers like we can with younger kids, and we can't necessarily rely on like giving them like a lollipop or something. And so sometimes they might need to be incentivized with something a little bit larger, and that might be the only thing that they might work toward, but it doesn't even have to be larger monetarily. So this is an example of a kid who worked to get a bunny as a reward. And so this is a system that I use in WeSpeak actually, but I use it with my individual patients as well, where if they are working on a larger prize, then I'll print out a picture on like a puzzle template, and they have to, each puzzle piece represents a goal that they're working toward, and you're really in control of what the goal is and how many points they need, how many times they need to accomplish that goal in order to get the puzzle piece. And so, you can kind of calibrate accordingly and you can change it, but it really ensures that you're continuing to move forward rather than, them just kind of repeating a goal over and over and getting puzzle pieces for that. So with each new goal that they work on that's built from the last one, they'll get an additional puzzle piece, and they can be working actually on a couple goals simultaneously. So one can be responding to the teacher, one can be, initiating a text to other kids, and if we say, if for every 5 times, 10 times that you do that, you get a puzzle piece. Going back to the rewards, you could use a reward menu, which is kind of just different point values correspond to different rewards, and then they'll have almost like a bank that they can collect points for doing exposures and then kind of spend those points accordingly. In order to identify rewards, it's often hard for them to do that in session. Like if I'll ask them, what do you want to work toward? So I'll have them do that with the parents outside of session or between session, and then come back to the session with a list of rewards that they want to work toward. I have parents think a lot about, because sometimes they'll say, yeah, I don't want anything, because maybe it's hard for them to make a decision, maybe it's hard for them to ask for things, or maybe, identifying something that they do want makes it, very real that they're going to be working on this stuff. And so then the parent will have to kind of reflect on what they've asked for in the past, or just be attuned to what they're asking for moving forward. And I give a very exhaustive list of ideas just to kind of trigger anything that they might also think of. In terms of earning the rewards, we want to make sure, again, that they're not just earning rewards for the same things. So you want to keep upping the ante in order for them to get points toward their rewards, and make sure that they know that the bar is going to kind of keep getting raised. Questions about rewards and contingencies?
We have 4 minutes left.
I will answer those over email.
No new questions have come in anyway, so I'm going to say if you want to choose what you think are the most important points in your last few slides.
Yep. Actually, there's not much left. So I've gotten a lot of questions about medication resistance and how to address that. So first, I always want to know why they're resistant to medication, and I will let them know, like, that's okay to feel that way. But just help me understand what scares you about it, because that's going to then direct you in terms of, the discussion that you have with them about it. And it might be that, I'm worried. They're also probably not going to say, here's what I'm anxious about. And so I'll need to give them a list of options that are typical among kids who are resistant to medication, like, it's going to change my personality, it's going to make me muted and numb, it, is going to give me side effects, I don't want to feel like I need it, there's stigma around it, I'm gonna, I feel like weird if I need to take it. And so I'll pose these to try to actually just understand what their resistance is. Then I'll talk to them about what really is like a foot in the door technique of, let's just get them in for a consultation with a psychiatrist. And usually once they're in for a consultation, then they're able to get information, actually meet the psychiatrist in person. And I do this by saying, like, look, just go in, get information, go to the evaluation. The psychiatrist, will see if it might even help you. They'll be able to give you information about it, and you don't have to do anything at that point. So you can walk away without having made a decision. You can walk away with a prescription, without a prescription, and there's no obligation at that point. And so this is a way to kind of take the pressure off of just going in and getting that foot in the door. In terms of options, I just had this conversation recently with a kid, and I don't know that it would always go this well, but this one went great. So she was extremely resistant to medication, and I said to her, "This is some MI stuff, motivational interviewing." So I said, "All right, so here's what we want to be clear about, kind of what the different paths are and what those would look like. And you make a decision at that point. It's up to you. I just want to make sure that you know exactly what to expect with each of these possibilities. And so, the first one is stay like this. It's certainly interfering. You don't like feeling this way. You want things to change. And right now, that without the medication, that seems really hard. The second one, take medication. It could help, who knows, but it could make things easier. And the third one is, okay, so if you don't want medication, but you want things to change, this means actually that you're going to have to work twice as hard. And that's okay if you choose that route. But I want you to understand what that will look like and what that means. And so we talked through that, and she actually chose the third one. And since then, she has been busting her butt. And so when she committed, she said, okay, I understand what these options are. I still don't want to take the medication, but I'm willing to do this. She committed to it, and she truly has been working twice as hard since then. So it's okay if they don't want to take the medication, as long as they're willing to, if they want things to change, do that. And sometimes you have to let them experience a low point, actually, instead of just rescuing them, in order for them to see how hard things actually are for them. Parenting was really woven into the rest of it. in terms of the rewards and contingencies, and how parents can kind of scaffold with the school stuff. But the most important thing with the parenting and following through on that stuff is consistency and ensuring the follow through, because otherwise it's not going to be effective. That's it.
Sorry, I forgot to unmute myself. Wonderful. Thank you so much for another amazingly informative talk. I have furiously written down so many of the things that you were mentioning, and you really got a lot of like great idea, and thank you so much, and this is awesome in our questions. So everyone seems to really appreciate your time.
Good.
So Dr. Avny will respond to questions that we didn't get a chance to address via email, so be on the lookout for that. I'm sure it won't be instantaneous, but in the next few weeks. And if you have any follow-up questions still outstanding, you can certainly ask them on the listserv. So thank you again for your time. I hope everyone has a wonderful weekend.